Good morning, my internet friends. Welcome to the Medicare Cafe. We're going to go ahead and get started, but you might be confused because you're like, Olivia, why are you by yourself? Did you shower today? Also, yes. But today I'm supposed to have one of my personal friends in this industry and somebody who I was really, really excited to talk to, Mr. Jotham from Devoted. We've worked with Jotham for several years. It's a small world, small industry. So, well, never burn a bridge, first of all, because if there's somebody that you don't like in this industry, chances are once you're in this industry, no one ever leaves. So never do that. But Jotham's been a friend of ours for years and years and years. And so today I would love to have him sitting right here next to me. It's not the plant. I'm not interviewing the plant today. But as the world turns, isn't that a show? That's like one of those like crazy anyways, but as it happens, Jotham is running a little bit behind today, so hopefully we'll be able to get him in before the end of the cafe. Hopefully we'll be able to get him in-house today. If not, if we have to close beforehand, him and I will just do an interview and talk and discuss and go over what's going on with Devoted, because Devoted is a company that I have personally fallen in love with. It's a company that you may not have heard too much about, but it is one that does, again, it's just a tremendous company to work with. Their dedication to health, yes, healthcare, but their dedication to consumer health was like truly inspiring, what they're doing with healthy food benefits and things like that. So hopefully, if he gets here before we have to end the show today, Sadie is going to escort my new friend. Well, he's not a new friend. Escort my friend. He's going to sit right here. We're going to have some discussions. But until that happens, what are we going to talk about today? Honestly, whatever you guys want to, whatever you all want to talk about until Jotham gets here. So, couple things. It's kind of going to be like an impromptu AMA, Ask Me Anything. The senior marketing specialist hosted a few road shows. We did 3 of them, Kansas City, St. Louis, and in Columbia, and we talked about some changes coming up in 2025. Hopefully, I know a lot of our viewers attended those, got some good information out of that. I wanted to give an update as far as all that is concerned. So one of the biggest updates is actually coming, and I'm going to keep an eye on my phone to see if my friend is going to join me. So I'm not being rude. I'm just being prepared. So, and if you have any questions or you do want to ask just like some updates, again, this is going to kind of be just an AMA, just me and my closest friends of the cafe chatting, getting prepped for AEP. If you have questions, comments, concerns, threats, or promises, text this number. That is my cell phone. So if you have any questions, please text me, or of course, you can put it in the live chat feature as well. I'm happy to discuss anything with you guys because this is insurance. We got to think on our toes. So, okay, so one of the biggest updates I want to let you guys know about was the update to what prescription drug plans are going to look like this year. We've talked a lot about prescription drug plans due to the Inflation Reduction Act going crazy. It's basically really, really high premiums, formulary changes, deductibles being applied back to tiers 1 and tiers 2. If you have questions like why are plans doing that, come talk to me. We can have more discussions about what the IRA is doing in regards to all of that. Couple updates to that. So the Biden administration passed through because they saw the hardships that were going to happen to prescription drug plans and to, again, beneficiaries having to pay for those outrageous premiums and deductibles that they may not have been familiar with or used to. They have released basically, it's called Part D demonstration. And so carriers have up until yesterday. So as of yesterday, carriers had the opportunity to opt in to Part D demonstration, which is essentially the government. I'm going to use the term subsidizing. I don't think that's the correct term, but it's the term that's coming to my head. The government is essentially subsidizing or giving carriers extra dollars to help overcome so that price increases and the burden of handling that expense doesn't get passed on to the beneficiary. So it is really possible. Again, carriers had to opt into this by yesterday. So it's, I mean, like, and what carrier is going to say no to money from the government to help so that their plans. So anyway, so we are seeing some carriers have come out and talked about what their plans are for prescription drug plans. I don't have all the details. Obviously, we know some carriers like Mutual of Omaha got out of prescription drug plans altogether. A lot of the fear was because early, when they were talking about the final ruling, that additional $100 that carriers were going to have to pay commission-wise. Well, carriers didn't have that income. They did not have money to, in addition to the smoothing, in addition to the administration costs, in addition to the $2,000 MOOP, in addition to all of that, they did not have money to then increase the commissions to Part D. So a lot of carriers had talked really open about ceasing all commissions on their prescription drug plans, right? So we have seen some carriers since then come back and say, you know what, since we don't have that extra $100, we're going to go ahead and pay basically business as usual. Again, I'm just looking at my phone. Business as usual, everything is fine. While other carriers have actually come out and said, hey, we're going to continue to have our Part D plans be non-commissionable this year, and in some cases even stop the renewal commission. So more to come out on that. Again, we can't be carrier specific yet. We can't be carrier specific yet, but just understanding that that is something that a lot of carriers are seeing. So what will the Part D environment look like? We still don't know. We're getting a lot of updates, but we'll know much more about mid-year. Again, I do see some text messages coming in. I do see some messages asking about where is our special guest? Where is Devoted here today? And again, so long story, Jotham actually texted us over the weekend and said, hey, flights are crazy. Apparently flights are still being canceled constantly because of, I'm going to say Microsoft. I don't know what actually happens. Somebody should educate me. I don't know. There's not enough room in this brain to understand all of that. But he told us that, you know, hey, I want to make sure, like, if I need to reschedule, can I? And so we talked to him. We thought we were going to be good. We thought everything was set. So again, it is still very possible that my guest, Jotham, will be joining me here today. If he isn't here today to talk about Devoted and talk about what Devoted does best, which is keeping people healthy, getting people healthy. Devoted's approach to healthcare is so unique. It's less about like how do we fund the healthcare? Like obviously that's still important. Obviously they still fund healthcare, but it's how do we give control to our members to get access, better access to care and access to like things like healthy food. So if I don't get a chance to sit with him today, we will make sure to record a video and send it out to our audience because you may not have heard of Devoted. They're not a new company, just so that you guys know. They've been around for several years now. There actually was the number one by percentage fastest growing health plan in the United States, and their footprint's not big. So we're going to talk about that. I think he should be joining here soon. So I'm getting some questions. So again, if you have any questions, feel free to text them. I just got a fun text message from him. He goes, it starts at 11. No. So we'll do a video with him later on today. So Terry, thank you so much. Terry asked, hey, where can we get that presentation for the smoothing program? Okay, so yes, senior marketing specialist, as you know, we have been doing seminars in a box for a long time. We have an educational seminar, we have marketing seminars, a ton of stuff for you to be doing for your clients to build rapport, become the expert. The interesting thing that we actually offer, which I'm really excited about, is because of our relationship with Integrity. Integrity is mom and dad. They have built a compliant smoothing, it's an IRA presentation. And so if you guys want that, you have to make sure you go to our AEP toolkit by going to smsteam.net, making sure you're logged into our website, scrolling down, going to the AEP toolkit, and it's under like client letters and things like that. But there is a section on there for you to be able to actually download and get the smoothing provision webinar series. So that is available. It is really cool. And the reason like how people are using those is essentially because there's a lot of questions on like, we know this AEP is going to be wild. They're talking up to 80% shopping rates. We know things are going to get hectic. What can I do today? So like, what can you do today? Obviously, contract, with all the carriers. Obviously, certify. Obviously, get ducks in a row, working with your networking partners. But a really like tangible thing you can do right now is be the loudest that you are the expert, be the absolute loudest. And so a way that you can do that, because we can't talk about 2025 benefits yet, you can't do that until October 1st, is to be the loudest about what's going to be the most confusing thing, and that's the IRA and smoothing. So I would be considered an educational event, so it doesn't have to be because you're discussing Part D, and in cases Medicare Advantage plans, but you're not discussing carrier specific stuff, so it's not a sales event. It is an educational event. Reminder, educational events are not, thank you, Senior Marketing Specialist. Educational events are not registered, but they do still have to abide by the rules and regulations set by CMS. So just keep that in mind. But yeah, that's where that's located. Senior Marketing Specialist says, I look taller today. Yes, it's because I don't have a giant next to me right now, like normal. Okay. So again, if you do have any other questions, comments, concerns, sets, or promises, put it in the questionnaire box. Again, we are really thinking that Part D's, what we were estimating, 3 months ago, what we were kind of seeing come true was the Part D premiums, Part D deductibles being applied more, just a lot of that burden of the cost being put on the consumers. Again, thanks to the Part D demonstration, it looks like carriers are going to get relief from the government to not pass those costs on to today's seniors. So that should have a significant impact when it comes to shopping for those plans. So that's the big update that I have for you. I just got a text. Sadie's like, do you want me to come join you? I'm like, might as well. So again, if you guys have any questions, comments, concerns, sets, or promises, let me know. But some other news, some other updates, just so you guys know, we are joining next week as United Healthcare. They're kind of the last company to do what we call like a rollout, the last company to really share what they have going on. And so United Healthcare, their national rollout, which they open up to only a select few of their people, is next week. And it is like an overnight trip. So we have our several members of our team going up there to kind of see what's going on in the world of United Healthcare. But we're getting really, really positive things, really, really positive insights about what they're going to expect. So this year is... I have a message that the eagle has landed, which probably means star in the building. It probably means that I have Jotham on the way here. So I'm going to hang out just a little bit longer while I delay. Just so you guys know as well, this week on starting every day today at 11 from Tuesday till Friday, so not yesterday, but Tuesday through Friday, we're also having our AEP operations training, which is essentially if you have an admin group or if you have admin staff on your team, making sure that these are things like how do you check the statuses of your applications, how do you order supplies, how do you check your commissions, how do you how do you do business, how do you use Medicare Center to help you with the client sync stuff. So all of that is going to be on there this week. More details to come. But if you're interested in attending that, if you have admin team or if you do that yourself, make sure you go to smsteam.net, click on the events tab, and if you get registered for one day, it does automatically register you for the rest of the days as well. So make sure. Oh, I hear him, guys. She says I already live. It's my friend. Hi, my friend. Come on in. Come join us. What did you do? You have a cane.
Oh my goodness, I have a cane. I wasn't sure if I'd be navigating stairs.
No, we don't make people walk stairs. This building that we're in is actually the old Social Security office. Everybody, welcome my friend Jotham.
Hey everyone.
So what did you do? Is it a story that you can share?
Oh, it is a story I can share.
Let's hear it.
So, apparently I am
I love it already.
I don't remember how to ride a bike. Apparently.
So the one is like it's like riding a bike, you'll just pick it back up?
Yeah, you just pick it back up. So I just got back last night, as you know.
Yeah.
From a 2-week long trip to Europe.
Oh.
So I was in England
So like your first day like back is like with us.
with you all.
Oh, that's really exciting.
And I had this at 11, so I'm sorry I'm late.
Well, I'm wondering it's because like when we sent you the invite, you were like on Eastern time,
could have
and it would
been.
have been like it's Eastern 11 o'clock.
And you said 10, and I put it in, and it was.
You're good. You're
so
good.
I apologize.
No, we're just hanging out.
I don't know. So, but yeah, so I was over in England, and everyone walks there.
Yeah.
Or bikes. Or
Okay.
whatever.
Okay.
And I'm
I like Vespas. Did they Vespa too, or is it just bicycling? I know very little about England.
I don't know what that is.
A Vespa?
What's
It's
that?
like a scooter, but like
Oh,
fancy.
yeah.
Like a
They
fancy
had those
scooter.
fancy scooters.
Okay,
too.
got it. Okay.
But I was on. They have the little Uber bikes that have lime on them.
Yeah.
And so I'm like, oh, that's cool. And I got the Uber app. So I'm like just scooting around on this thing. And, I'm going and seeing all the things. I go to this, the National Library and like look at all the stuff or whatever. And I'm coming back to the little flat that I'm staying in. And I'm just trucking along. And I mean, probably going a little faster than what I should have been, whatever.
Sure.
And a lady like comes in the crosswalk. And I immediately was like,
Locking
and
it up.
I just froze. So I didn't like think to ring the bell or scream at her or whatever else. And I just locked it up. And then I hit the curb. I think in my mind, I thought, I'll just jump on the curb and drive on the sidewalk.
Yeah, this is
that
fine.
didn't happen.
No, we're not athletic like that anymore, are
no,
we?
but just like that. So my knee went like that. And so here, if these are knees, right?
If these are
like
knees.
that. Yeah, so I didn't hit the lady.
Well, okay. There is a silver lining.
And I had an experience with the National Healthcare System.
I was going to ask,
So,
how was the National Healthcare
it
System?
was something.
You're just like, I work at Medicare.
And I actually told him that. I was like, yes, I was like, I actually work on the payer side, in the States. And it was, so I could like hardly walk. I couldn't put any pressure on my medial collateral ligament of my left knee, if anybody wants to know that.
First time I've heard that phrase in my life.
So yeah, it 33 minutes that I stood in line to get, and this was after a taxi ride from the point in the accident, which was about 25 minutes or so.
Sure.
And then I stood in line, I started the clock. I thought, I'm just going to time this 33 minutes. I was hurting. It was bad.
Yeah.
Hobbled in. It was the emergency department. And then I went and I said, do you have like a wheelchair or anything I can sit in? They're like, no, we're out. I'm like, okay.
Awesome.
So I'm like, I can't still like put pressure on this. Hobbled down to the urgent. So you have to be admitted there through the ED, emergency department.
Okay.
Then they send you to urgent care if it's not life threatening. I'm like, I'm not dying.
No, I'm okay.
My knee hurts, right? They immediately give me like 2 aspirin and an ibuprofen. I thought, hey, that's a win.
We'll take it.
We'll take that.
We don't have to triage for that. Perfect.
And then they made me hobble back to get an x-ray. And then hobble back to urgent care. And again, this is just, 5 or 10 minutes in between each thing. And I'm still walking around. I don't have crutches. I don't have a wheelchair. I don't have anything. I can barely put weight on my knee.
No, I don't like that.
And it's all like, at this time.
Like there's like a basketball in your knee.
It's just swollen. It's gross looking. I mean, there's obviously something wrong. And
looks like you're walking out like the people that walk around at Walmart at 3 a.m.
Yeah,
like
I get into finally get back or whatever I'm saying. I prop it up, pain medicine kind of starts working. And about the whole thing took about 3.5 hours. So about 2 hours and 45 minutes into it, I get to see the nurse practitioner. She was lovely.
Okay.
And she. We're talking. I was like, I think I just need a brace, and she said, "Oh, we'll do the most sensible option." And I was like, "Okay, well, we'll do that." And honestly, so she gives me this like compression sleeve, and immediately when I put it on, I felt like, oh, my knee finally stabilized. I could actually put pressure on my leg again. And I'm like,
I'm fine.
Miracles, like, right? It's a
magic sleeve.
I just needed some Spanx pantyhose or something. I don't know what it is. Like, and so like I have this, I'm like, wow, I can actually, I can't really bend it well, but at least I could put pressure on it.
Yeah.
And she's like, okay, I want you to be mobile. I want you to keep walking. I do not want you to like, she's like, I want you to stretch it out, but I don't want it to get stiff. Like, you'll be better if you stay mobile. just don't overdo it. And then she gave me these crutches. So I got 2 of them. I take one just in case I still have to navigate stairs because stairs are still a little iffy for me.
Sure. No stairs here. I'm too lazy for stairs. I'm not doing that. Well,
so,
I'm glad
all
you're
of that,
here
yeah.
in one piece. I'm glad you're back home, and so thank gosh. I'm so happy.
Three pills, a set of crutches, and some pantyhose. And boom, you're done. That's
Honestly,
national healthcare
if
system
that's
for you.
I was gonna say, you're either in the Boy Scouts, going on a camping trip, or you're in the national healthcare system. So, welcome. Well, anyways, all my friends, this is my good friend Jotham again. We've known each other for years and years and years now. We won't talk about how long, but a while. And we've got to work with Jotham for so long. And when we found out that you moved over and started working with Devoted, I can't tell you how excited we were, because Devoted is a carrier that since we started working with them was just like, man, we got to make this work. A lot of times the plans weren't in where our footprint was. We just love this company, and we found out you were on board. We're like, oh, our problems are solved. We're good. we're gonna see a ton of it. So tell us a little bit about yourself. This is Medicare Cafe. We're really uptight. We're very, very serious about how we talk. It's very professional.
It's right up my alley.
Perfect. Tell me a little bit about yourself and how you found yourself at Devoted and why do you decide to be there?
Absolutely. So first, thank you for having me. And again, I apologize that the time was crazy on it. So, but yeah, Olivia, we've known each other for many moons now. Many moons. Too many moons. I have been in the industry for about almost 25 years. Wow. October will be 25.
Wow. So you started when you were 2.
I was 2, 2.5. And so, yeah, it was not necessarily what I thought I would be doing. But here we are, all these years later, killing it. I worked on the broker side starting out here in Columbia. And then moved to a large carrier, may have a blue in their color scheme.
Could.
And then went back to the broker side, went back to another large carrier, and then landed at a regional plan in St. Louis for the past 10 years. And then I left there about August of last year, so almost a year ago. And then this opportunity came up with Devoted.
I love that.
About 4.5 months ago. So I started there April 1st.
Very cool.
And I love it because it really, what drives me in the Medicare space and in the healthcare space aligns very much with what like the vision and the mission of Devoted is.
Yeah.
So it was very kind of just symbiotic in how that came together with what I'm passionate about, what they're passionate about. And it was just good timing, and that's a lot about life where it's just great timing
the
for,
stars align.
Everything just kind of happens. And I'm a person that believes everything does happen for a reason.
Yeah.
Even a bummed knee.
Even a bummed knee.
In England. But it's like, okay, these things are happening and get into the flow and the rhythm of life and how things move and shake. And so with Devoted, it's like honestly just a very natural transition for me. I get to work with people that I've worked with for years, and be able to continue to pursue things that are passionate to me, and really focus on, the mission of Devoted is to, provide healthcare and, deliver quality to every member like their own family.
Yeah.
And that just resonates with me very well. Some of my earliest memories are with my grandma at the nursing home. I don't know if you can say that these days, if that's really the right term.
Is nursing home not the right term?
Long-term care facility.
Is it grandma or nursing home? Which one are we not okay
there's
with?
that too, right? It's like, I called her Meemaw, but I don't know.
Okay.
But, with my Meemaw at, now it's a long-term care facility, right? It's not really a nursing home. But back in the day, that's what we called it. And, they're her friends or the shut-ins, or the people that may or may not have had other people around to visit them. And, of course, I'm like the 3-year-old cute little boy, that's
friends
there.
With
and I'm sure they just thought, oh, it's great because there's a kid there who's, and it brought a lot of life. And I can remember them giving me, the circus peanuts.
Oh, yeah.
Do you like them?
My
wife hates them. She thinks they're disgusting.
So that are you talking about the marshmallow?
Yeah, the orange. No.
Yeah, see? No, No, sir.
I still love them to this day.
Oh,
I will
no.
still eat them. My wife thinks they're nasty.
Cold because they are. Sorry.
Yeah. I mean, they're like kind of like styrofoam, but I can remember getting them, and probably because I'm a kid, they can't give me hard candy or something. They can give me these little circus peanuts, and maybe they didn't like them either. Like, Mike will eat everything.
It's sugar, yeah.
But so I can just remember those like being handed out and just really visiting with them, and you kind of as you get older now, as I get this age, middle age, I like to say. You start thinking about like, okay, now I'm starting to care for my parents and my wife's parents, and like, how does that, and how much dignity and respect are we giving to our older generations and the older Americans? And so it really ties into, what I've done in Medicare for the past, couple decades. And that's what I love about Devoted, is that we take kind of those things that are, passionate, what I'm passionate about, and being able to tie that into my job.
Yeah.
As to like what I grew up with,
and
like what was important to me and values that I had in my own family.
So that's what, again, I loved. I actually got to go. I saw you in Boston this past year for Devoted's rollout when they were talking about that. And that was the first thing that sold me, was that, yes, they're going to talk about their plan benefits. Yes, they're going to talk about dollar amounts and copays and things like that. But what they wanted to talk about was healthcare, but not in the way that we traditionally see healthcare. More healthcare is like, how do we give the power of health back to our members? How do we give them options to get good health care, to stay healthy, to invest in their own health care? So can you tell me a little bit about like Devoted's, like their mission, which is help everybody like their family? Can you tell me a little bit about how that mindset makes it all the way down to, what is it called? The people who, like, the other companies call it customer service. You guys call them
member guides.
Yes. Can you tell me a little bit about like how that mission, who came from two of the nicest, most intelligent people I've ever met in my life.
Oh my gosh, the Park
brothers. Oh my gosh, they're
phenomenal.
Amazing.
Yes, they are.
Close friends with Howard Schultz, which is just wild. So how does that message make it all the way down to who are beneficiaries, who they're talking to?
Yeah, it's amazing. And having only been here, like I said, about 4.5 months now or something like that. Just how much each of the Devoted Nation, the devotees, it's like cult-like, I know. So just how much that passion and that vision just trickles down. And I do believe that like there's so much to be said for like leadership of an organization in, that's casting that vision and really adhering to it and seeing that just being propagated throughout all the employees, and even down to what you're talking about too. What I would say is the front line, and what we call is our frontline folks, right? Our frontline folks are those folks that engage with and interact with our members on a daily basis. Obviously I don't necessarily do that. Do I have some member interaction? Of course, or will have, once we have membership. But those folks that actually engage with them and just to see them in action, as you saw in Boston, was just incredible.
Literally crying I'm ugly crying in the middle of this professional meeting of these people talking about their passions and
they
helping
really,
their stories.
They really do a lot of great like service, if you want to call it service, but it's guiding them through the whole thing. Just like I kind of started out with the story of like, there was no one to guide me. And and it's like take it all back. There was no one to guide me. I'm like, where is the x-ray? They're like, well, just follow the signs. And you're like, oh, okay.
Fine. Yeah,
I'll follow the signs, drag my leg, like follow the signs, like, and then try to get back. Like, and then if you think about our healthcare system, and it's complex, right?
Very.
I mean, it's complex. And so having those folks there to guide, and we have member guides, we have community guides, we have digital guides. I even say we have broker guides, but all of those folks are there to really help people through that navigation and navigate that complex system. And the passion that we see is very similar to what, when you saw the Park Brothers. And you see like, hey, this is our mission, is that, we want to just drastically improve healthcare by treating everyone like family. Those folks that we get into those roles, they may or may not have like a stereotypical customer service from an insurance plan background, which I think is smart.
Yeah, yeah.
Instead
they're people.
of,
They're like the insurance, like it's just like the whatever. They're people who are putting people first.
Absolutely.
Yeah.
That's a great way to put it. Great way to put it. Because we're looking for people with qualities, not necessarily, oh, you can check this box that you've worked at this company
mirror.
doing
Okay,
this for X amount of time.
Yeah.
But when you look for qualities like, compassion, qualities like, can you empathize?
Sure.
Those are the types of qualities that we look for in those member guides so that they can engage with the member and say, you know what, I can understand that. I can feel that with you, and let's work to getting that problem solved. I mean, another great thing about our member guides is they're not time stamped and trying to get people through the queue.
Yeah, and
right?
that's like we experience that when we're calling carriers. Is like we have a list of questions, like you get 2. Like we have time to answer 2 of your questions, then you have to call back.
I got to be off here in 2.5 minutes.
Exactly.
I got to get the next
get
call.
in trouble as a rep. I get in trouble if I'm on the phone for too long. That's very common. Very, very common. That's the norm.
Yeah.
So, and then you were, sorry, I interrupted you to say, like,
it's quite all right.
That's a huge deal. That devoted is not measured by that.
Right. We look at, can this problem be resolved, and can this issue have resolution, in this conversation, in this phone call, in one time.
Yeah.
First call resolution, as we say. And we really strive towards that with our member guides, and really connecting with the folks that are on the other end of the line in a very real and compassionate way.
And it comes through. So another thing, because when we're talking to our agents about, like, we have to make sure with this upcoming AEP, with the IRA, with the smoothing, we say, I don't care if you've never written this company before, you have to get contracted with all carriers. You have to be ready to go. So that October 1st, you're not like trying to scramble, trying to figure out, oh, I didn't know I was going to need this carrier. So to that point, a lot of our agents, especially where you guys are expanding, right? Especially where you guys are coming into new areas, we've known Devoted for years now because you guys have, been making your way this way, right? And we know that last year Devoted was the #1 growing carrier by percentages, right? So all that to be saying, agents who may not be as familiar with that name or only is going off of like what we're saying, what they're hearing, it is a smaller carrier. Can you kind of talk about why, yes, insurance agents, they need to have what I call big dogs, those names that you know. Why is it really beneficial to have a carrier that has the size of Devoted? I use the words the nimble, like how they're nimble like Devoted.
That was the word that was coming to mind that I was going to say. So you just took it and ran with it.
I stole everything.
I love it. But I would say that's a huge component. Being nimble, being able to pivot with various things, components, issues, resolutions that are happening, not just within the company, but also within the industry, right? Yeah. And we're seeing that now. Yeah. We're seeing that with the things that you mentioned with the IRA, with, the actual just, reimbursement levels. Yes. So we're seeing a lot of disruption in the industry right now, which obviously is trickling down to this AEP, which is what you're referencing. And I've worked for both what I would call the big box companies, right? As well as the a small regional plan. And I feel like, Devoted's kind of like in between those. Yeah. Where, you do have like not the volume of membership that like the huge ones have, but you're quite a bit more than like the small regional players. I think
the resources. You have the resources of the big guys, but you have the flexibility of maybe some of those regional ones. Is that fair?
Yeah. And yes, that's very fair. I was going to say, and the reason we have that, going back to the Part Brothers, is we were built and kind of based around a solid technology platform that we
we don't operate. Like they built this technology. There was no third party. There's nothing. It's literally like we talked to the developers of this technology, and it was a whole nother league of what they can offer.
I mean, and that's one of the reasons why we're able to do like first call resolution and things like that very quickly. Everything's tied in together so that, if a member calls in, like it's all right there. Yeah. They can see it. They can, the member guy can see it really hone in on, okay, here's I see what's going on. Let's fix this for you, or let's get you to this service, or let's see if we can't, find a solution over here. And then we can go back and listen to any kind of recordings.
Yeah.
But then also, let's say that something's loaded incorrectly from a provider standpoint. We don't have to submit a ticket to go to a vendor to bid 3 weeks for a root cause analysis to figure it. Like, we can have a change immediately and get all of that resolved. Like,
so it makes
hours,
it feel like
not days or weeks.
Yeah, the beneficiary actually has power and like what they can do, what their access is, versus like I'm answering a phone from somebody who is a part-time temp worker for us because they're too busy. They're just going to follow a script. And if my answer or my question's not on the script, then they're going to put me on hold and put me somewhere else. It kind of gives the beneficiary true access to the resources, access to their help, and access to their benefits.
Absolutely. And again, going back to like, why is that important for agents to have devoted in their arsenal for this coming AEP? With the disruption, having, too much dependency on any one may not be the best solution for the individual broker, as well as what's really the best solution for the member. And are you placing folks with the carrier, if you will, if you want to call us carriers or what have you, that really have the best benefits, that really have the best service model, the best sustainability long term. So I think all of those components really go into how we look at where are we putting people with their plans. I have not seen our benefits yet.
Yeah, exactly.
And I think that's like a lot of carriers. Like, have we seen any benefits yet?
We don't know, and that's what we've been talking about. We're not going to probably for
at least another week or so.
Yeah,
maybe 10 days. But outside of benefits, and I mean a lot of decisions are obviously made because of benefits, and I get that, totally get that. But outside of that, like, what are really the key components you're looking at from a carrier, from the insurance company, if you will? And I think that service, I think that response, sustainability long term. You're like, oh well, Devoted's a new carrier, but if you look at the stats of how we've grown, like, and looked at what our plans have been over the past 6 years of renewal cycles. You'll see that it's very stable. Yes. And we're not in the business of going into a market, buying up a bunch of market share, and then figuring it out on the back end. And then trying to like adjust everything, shed and like all of that. No, we really want to get in and grow. And I consider it like a heartbeat, like where you pulse. I'll get on camera, where you pulse out. And then, so like year 1, you're pulsing, and year 2, you're pulsing, and year 3. And it's almost like a ripple where you see that kind of get larger and larger and larger. And, as we approach the markets that we're going into in 2025, this coming AEP, I think you'll see that same methodology and that same thought that we've had kind of from the beginning.
So let's talk about a little bit from the beginning. Again, I'm asking you all these questions. You received no prep for this. You did not get a single question ahead of time. And to be fair, I also did not prep for this because it's authentic and we love being authentic. And
I've been gone for 2 weeks.
And you've been gone for 2 weeks. So you know what? I actually did email you all these prep questions. They must be just deep
I did check my emails. I did check my emails.
So my question to you, again, we talk about the Park brothers, who, again, their story, it's just two guys. I mean, like, two incredibly brilliant, intelligent, amazing, heartfelt guys, but they're the ones doing the presentations at these rollouts. I mean, like, the creators, the people who, like, are some big brand name on a corner office that you'll never hear or see from. They're too busy on partner calls, whatever. These people were the ones educating us about their story. And so what I love about their story was it started off because they built, and fill in the holes for me, but they opened up like a women's health clinic, right? It was some sort of health clinic that they opened up because they saw a need, like, this is an area we need more attention, our healthcare needs help. And then they were all excited about it, but then the clinic failed. And they said, okay, so this isn't where we need to help. We need to help on financing and helping people get access to this care. And so do you, like, is there anything else that you want to say? Because their story is like, these are just two human beings that genuinely just, like, they saw where we're not doing well. We're not taking care of our most at-risk people, which is our seniors. and they stepped in. What am I missing here? Like, that's just was so pure.
Well, I will do one shameless plug as you're talking about
Okay.
them talking
Yes.
at and being like real people.
Yes.
Ed is actually going to be at the rollout in St. Louis next week.
What?
Yeah. So if you're
guys
not
are meeting a
RSVP'd yet,
celebrity. If you are not going, that is a celebrity.
Yep.
For sure.
So he will be there. It's August 14th, Wednesday.
Okay, August 14th.
It's 2:00 in the afternoon
Okay.
at City Park, downtown St. Louis. It's the soccer stadium.
That's nuts.
Have you been to the soccer stadium?
I've never been to
I
the
haven't
soccer
either, so I'm
stadium.
excited about being there.
That's
so
nuts.
yeah, so Ed will be there speaking. So highly encourage all your listeners and all the people that you know that are out there to get to
literally listening to him speak. I was just like, this is like talking, like this is like I'm drinking a beer with my buddies, just having a good time talking about like, so what's going on in the industry. He's just so real.
Yes. That's so nuts. Down to earth.
That's nuts.
And so the two of them back in the 90s founded Athena Health, right?
That's
which was
was
EMR at the time, which is EHR, Electronic Health Records.
Got it.
Ended up being like a $5.7 billion company or something. Just
casual.
Whatever.
Yeah.
Chump change.
Yep.
But yeah, they founded that. Were instrumental, obviously, in that. Have built that over the course of time, and then somewhere in the mid to late 2000s into the tens, if you will. I don't know, what do you call that decade? 10 to 20.
Fun.
It's not teens.
It was fun. That's what it was.
It was something. But anyway, so Todd was actually asked by the Obama administration and maybe by the president himself to come in and help with get the ACA going.
Got it.
So at kind of the 11th hour, he came in to get it operational so that Obamacare could launch.
And he completely like glazed over that. That was just like a thing that he did.
Yeah.
Like, he didn't even like, that's wildly impressive.
That was just another Tuesday.
Just another Tuesday. Okay, fine.
So Todd then was actually appointed to be the first chief technology officer of this little entity called the United States of America, right?
This
so
thing,
our first CTO, because it didn't exist before that.
That's
but
nuts.
Yeah, so I mean, you're talking about like
and these are the founders,
the brilliance,
of
the intelligence, like the way that they can move and operate in the space is just kind of incomparable.
That's insane.
So we fast forward a little bit to like what you're talking about when they're looking at their parents are starting to go into this next season of life with dealing with Medicare, and they're like, wow, this is really kind of messed up, maybe a little broken. How can we take our skills and talents and really dive in there to provide solutions? Yeah, and I feel like that's what we've done. Yeah. I mean, I forget the name. The original name.
It was something with an O, wasn't it? Or is it the
Orinoco is what
okay.
we use for our system. That's the system name. I forget the original name that they were trying to call the company.
Yes.
And it was, you're talking about like failures. It just bombed. Yeah. It just like absolutely bombed.
And the guy who invented or was a huge developer on Orinoco was like, why don't we call it Devoted? And like, yeah, that sounds good. We'll call it Devoted.
And it works.
Yeah.
I mean, it works.
Yeah, it does.
And even our logo, I don't know if you see we're in our little logo here. It's a heart. I don't know if you can kind of see that, but it's a heart, and it really drives everything that we're doing as being devoted to our members, being devoted to being part of the solution. Yeah. And just really, treating everybody with heart.
I love that.
That's what we are.
Yeah, and again, like I know a lot of companies talk about that. A lot of companies talk about, we want to invest in our members, we want to give them access to care. But when you get to meet the people who developed this, who built this, who brought this team together, and they're like, we did this for our mom and dad. Like, this is why we did this. And our goal is, I don't care, you don't, as these guides, you don't have a budget, you don't have a rule set. It's if you would do it for your parents, and you like your parents, I should specify. If you like your parents and you would do this for your parents, then do it for your members.
And even if you don't like your parents, they brought you into this world. You should probably do it for
Might as well make sure they stay healthy. My last question for you, because we have this space for 11 for our, maybe that's where you go. We have another training after this. But they spent a huge amount of time talking about the use of technology and tying that to access to care, and saying that on average, when somebody needs to see a primary care physician, it could take weeks for somebody to see their doctor. And so they were talking about this other way of getting healthcare, their internal, their own developed system of healthcare that actually ties in with their primary care. Can you kind of touch on that? Because I've seen nurse lines, I've seen things like that. Never something that was this well established, well thought out.
Yeah, devoted medical.
Yes.
Is our, and you're right. It's virtual health. I won't even say it's like telehealth or nurse line. It's virtual health, where we have, on staff physicians, nurses, medical practitioners, ready to collaborate, I would say, with the general practitioners, with the primary care physicians and the other providers that are engaged in the beneficiaries' healthcare, right? It's not intended to replace. It's intended to supplement. And to really work together to make sure that our members are really getting all of the things, and I'm going to say that in air quotes loosely, all of the things. Very, very technical medical term.
Yes.
That's needed in order for the management of their health, right? So, you think about like utilization, think about medical management, think about, complex cases, and all the care that goes into managing chronic conditions. All of those things put into, this file or into this case, into this component of a member. And how can we manage that together? And how can we collaborate? And what happens when a member can't see their physician right away? And what happens when a member needs to call in and needs that care? And like, we know that like we've overnighted an iPad to a member so that they can engage and have one-on-one interaction in a virtual way. So it's not just on the nurse line, but like with a physician, and say, hey, okay, here, let's look at this. What's, show us what's going on, what's happening, and being able to interact with them in almost a face-to-face way virtually. So that devoted medical team is a huge component of what we're doing. And how we've seen that change, and I want to say change, but evolve probably is a better word, over the past couple of years has been incredible. And I think you saw that when you were in Boston, with the way that those folks interact and the way that we can really push out to the people to provide the services that are needed timely. And that's, I think that's another component of, being nimble. Being able to like provide solutions and, quickly pivot on things, shows that even though that we're larger than a regional carrier, we're in multiple states. We're going to be in 20 states in 2025.
That's really exciting.
Including Missouri.
We're very excited to have you guys here.
We are, still able to do like those innovative, collaborative components that you might not necessarily get off the ground quickly. If you're in a lot
having to pass it through a million different regulations. Yes, that's CMS. We still have to say yes to CMS, but yes, you're not moving an elephant, right? You get to be that nimble. And that's what I loved most about that healthcare, that was like, it was internal and everything. But like, I know a lot of systems, providers get really upset. Like, don't use them. You need to use me, even though it takes you 3 weeks to get me. This was something like, we're not competing with the primary carers. Like, we are working alongside them to make sure that like, you have a specialist here, your primary care here, your medicines over here, but one system where a person can be in there and say, this is the holistic view of this person. And this is an area where we need to make sure they're taken care of. Just the collaboration. I think you get that on a smaller carrier. And I'm using the word smaller, but what I mean is on that nimble, you get that ability to have more of that collaboration. And that's what I think shined through the most whenever I got to spend some time with Devoted, which is really exciting. So, Jotham, I appreciate you coming on today. I appreciate you wobbling in today. You could have said like, hey, I said like, if you need to reschedule, we can. I understand what it's like to be jet lagged. You're like, no.
I will be there.
I'm going to be there.
I will be there.
Pain and all. So thank you for braving. No stairs, but
just making sure,
Appreciate you for braving it. And again, okay, so if you're in the St. Louis area, That is going to be at, where is this?
City Park,
City
August
Park.
the 14th. So it's Wednesday, a week from tomorrow.
A week from tomorrow. Again, guys, if you have the opportunity, again, if you look at Devoted, like on a benefit spreadsheet and you're looking out there, obviously their benefits keep up, but it's really tempting to stay with what you know. You have to understand what their goals are and what their missions are. So I would highly encourage you to take a look at that, go to that meeting, get to meet Ed, which is just like, has to be one of my favorite human beings. Understand the passion that comes through when he talks. You have to understand when you're looking at selling Devoted, it's not just what can I compare on a spreadsheet. It's what does that person, that human being on the other side of that table need from me? And sometimes and oftentimes I think you're going to see Devoted is going to be a really, really popular answer when you're looking at it that way. So, Jotham, thank you.
You're welcome.
Thank you so much.
And if you're not in the St. Louis area, we also have Kansas City and Springfield.
Kansas City and Springfield. Perfect. Because I know that's where, on the west side of Missouri is where we were looking at a lot of potential expansions and things like that. Obviously, the east side as well.
Yep.
East side, west side. I don't know. Maybe I'm going to start like a border war on Missouri. There's enough border wars going on.
And reach out.
I don't know. We need more.
We can get all the details for all the, I mean, even if you're in another state,
Perfect.
you know, because I know this goes out to all
we're
folks,
we're in all 50 states. You said Devoted is going to be up into 20.
So
20 states.
we can get you connected with folks in any of the individual states that you're in or represent.
Absolutely.
And happy for you to continue on.
Thank you so much.
You're welcome.
If you do have any questions, comments, concerns, threats, or promises, again, this is my cell phone number, so you can text me at any time or call our office if you're interested in giving Devoted a look. 1-800-689-2800. Okay, so this is what we have to do. Whenever I sign off, when I end an episode, we have a catchphrase that we say, and it's have fun, make money, and give impeccable service. Okay, so I say have fun, you say make money, and at the same time we say give impeccable service.
Okay.
All right, you ready?
All right, we can do this.
All right, guys, so until next Tuesday, have fun,
make money,
and give impeccable service. Thanks, y'all. And we stop streaming, and then